Rheumatoid arthritis, or RA, is a chronic autoimmune disease. It causes the body's immune system to mistakenly attack its own tissues. This primarily affects the lining of the joints, leading to inflammation. The inflammation causes pain, stiffness, and swelling in the joints. RA usually affects joints symmetrically. This means if one wrist is affected, the other likely is too. Over time, RA can cause joint damage and deformity. This makes everyday tasks difficult and can be debilitating. RA is not the same as osteoarthritis, which is a wear and tear type of arthritis. It is a serious condition that requires lifelong management. Early diagnosis and treatment are crucial to slowing down the disease progression.
Rheumatoid arthritis symptoms can vary from person to person. The disease often begins gradually with mild symptoms that come and go. The most common early symptom is morning stiffness in the joints. This stiffness can last for an hour or more. As RA progresses, joint pain and swelling become more prominent. The affected joints may feel warm to the touch. Fatigue is another common symptom of RA, leaving individuals feeling tired and lacking energy. Other symptoms can include loss of appetite, low-grade fever, and even depression. It's important to note that not everyone with these symptoms has RA. If you experience persistent joint pain and stiffness, consult a doctor for a proper diagnosis.
The exact cause of rheumatoid arthritis remains unknown. However, researchers believe that a combination of genetic and environmental factors plays a role. People with a family history of RA have an increased risk of developing the disease. Certain environmental factors have also been linked to RA. These include smoking, exposure to certain viruses and bacteria, and even hormonal changes. For example, women are more likely to develop RA than men, suggesting hormones may play a role. While these factors may increase the risk of RA, they do not guarantee the development of the disease. More research is needed to fully understand the complex interplay of genetics and environment in RA. Section 4. Diagnosis and detection. Diagnosing rheumatoid arthritis involves, a comprehensive evaluation by a doctor. The doctor will take a detailed medical history. This includes asking about symptoms, family history, and lifestyle factors. A physical exam will be performed to assess joint tenderness, swelling, and range of motion. Blood tests play a crucial role in diagnosing RA. These tests can detect the presence of certain antibodies associated with the disease, such as rheumatoid factor and anti-CCP antibodies. Imaging tests such as X-rays, ultrasound, or MRI may be used to visualize the joints and assess for any damage. Early diagnosis is essential for effective management of RA. If you suspect you may have RA, see a doctor promptly to discuss your symptoms and get tested.
Section 5. Treatment and management. There is no cure for rheumatoid arthritis, but effective treatments are available to manage the disease and improve quality of life. The goals of treatment are to reduce inflammation, relieve pain, slow down joint damage, and improve physical function. Medications are a cornerstone of RA treatment. Non-steroidal anti-inflammatory drugs, or NSAIDs, can help reduce pain and inflammation. Disease-modifying anti-rheumatic drugs, or DMARDs, work by suppressing the immune system to slow down the progression of the disease. Biologic therapies are a newer class of DMARDs that target specific molecules involved in the inflammatory process. In addition to medication, physical therapy is crucial for maintaining joint mobility and strength. Occupational therapy can help individuals adapt to daily tasks and maintain independence. Lifestyle modifications, such as regular exercise, weight management, and a healthy diet, can also play a significant role in managing RA.
Section 6. Living with rheumatoid arthritis. Living with rheumatoid arthritis can be challenging, but there are ways to manage the disease and live a full life. It's essential to work closely with your healthcare team to develop an individualized treatment plan and make adjustments as needed. Adhering to your prescribed medications is crucial for controlling inflammation and preventing joint damage.
Regular exercise, even gentle activities like walking or swimming, can help improve joint flexibility and reduce stiffness. Assistive devices, such as braces or splints, can provide support and reduce strain on affected joints. Managing stress is also important, as stress can exacerbate RA symptoms. Joining a support group or connecting with others who understand the challenges of living with RA can provide emotional support and practical advice.
Remember that RA is a chronic disease that requires ongoing management, but with the right treatment and support, you can live a fulfilling life.